Okay, so I work an afternoon shift, like I said, with inpatient phlebotomy, and my shift starts from 2 o'clock in the afternoon until 10. And in the beginning of the shift, we do shift change when the day shift phlebotomist will give me the pager for the floor I'm assigned. And if there's a problem with the patient or some different problem that I need to take care when I take over the shift, and I get the information. I make sure that my cart is stacked because we have to push a pretty heavy cart full with the supplies, with the tubes and the butterflies and the tourniquets, and make sure that I have enough of supplies. Go up on the floors with a smile on my face. Go to the patient first, that then needs to taking care of most of it. And like I said, with a smile on my face, introduce myself, get the blood, say bye to the patient, move on to the next one. That's how it starts, and pretty much that's how it ends a day of inpatient phlebotomist. How about you, Miss Lisa?
Well, outpatient is a little bit different. In addition to drawing the patients, here at Michigan Medicine, we are actually responsible for spending a few hours. We register patients on the computer. So we are fully trained by Michigan Medicine to be proficient on entering patients, registering patients, ordering tests, whether they're U of M providers or whether they are outside providers. Little bit different. There's a difference between how we order those, how we register those patients. So it takes a little bit more footwork to do that. And then after we register patients, we, have a large enough group. It's not a solo effort. We have co-workers. We have our phlebotomists that once the labels are printed out and everything's confirmed, we pass that on to the drawing phlebotomist at that time. Now, that's not to say that I don't draw patients as well, but for 2 hours out of my day, I do not draw patients.
You just take care of the paperwork and the labels.
Take care of the paperwork and print out the labels, correct. Yeah. And my day starts off, I work Monday through Friday. I start off at 7, I end at 3. Sometimes if there's any, if something comes up and we are just slammed with patients, I will stay a little bit over. And I arrive at the lab at 6:30 every morning because believe me, it takes time to set things up as well as you set up, you have your tubes and your
ready. Yes.
I like to make sure that all the computers are, rebooted in that before we start our day. One other thing about when I draw a patient, we are also responsible for processing those labs. Once we draw them, we have to know whether or not the labs need to be centrifuged, if the serum, if it needs to be separated. We then aliquot our own tubes, or we have some of our coworkers aliquot if we don't have time to do it. We have to let them clot, aliquot, and then separate them into whether it's a refrigerated specimen, a frozen specimen, or a room temp specimen.
Which is a little bit different with us because we kind of spoiled the inpatient phlebotomy. We just draw the blood.
I wasn't going to say anything about
it. We kind of spoil. All we have to do is just not the spatial handling, which is mean that the blood needs to be put on ice and send it or tube it to the specimen processing and take care of us. Not us, but the rest of the labs. Like you said, whatever needs to be done, it's done by somebody else, not from the phlebotomist. We just send the blood.
Right.
Make sure that we have enough blood. Make sure that there's enough blood for the specimen, and everything else is taken care of somebody else. But with you guys, you really do have a extra job put on you.
Extra functions, yes.
Yes. Oh, my favorite part, my goodness is what I enjoy is when I go in a patient's room and I don't know what kind of news that patient has received today right before I went. And sometimes they sad, not sometimes, but usually they sad and if I see that they have a hard time dealing with whatever they have to deal with the moment, I try to reassure them that everything will be fine. Stay positive. It's UVM for you. UVM is the best, and they're going to fix you if nobody else can. UVM will fix you. And I think I'm pretty sure I can see how relaxed they feel. Even for a couple minutes, they feel relaxed that, okay, somebody's here to help me out, get through this tough moment, and somebody understand that I'm on the right place, and somebody knows that I'm on the right place, and they will fix me, and whatever comes in my way, I will deal with that, not only with my family, but somebody else outside the family, because sometimes people outside the family help maybe a little bit more than the people in the family, because we know they have to make us feel, oh, everything will be fine. But when a different person said, oh, you'll be fine, don't you worry, stay positive, it's kind of, okay, somebody else see my point, and yeah, maybe I really should start thinking positive, and yeah, maybe I should listen to somebody else, not just my family that, want to make me feel better. So that is my favorite moment, when I really can see that for a little bit I make a change in the way they feel, and I see a little smile, and they agree and say, yes, you're right. You know what? Yeah, you're right. I know I'm in the right place. I know UVM is here. I know you guys have the resources. I know you have the teams. And it's really, really warm and melts my heart. This is the favorite part of the day, when you can help somebody get over the bad news and the stuff that they have to deal with. Because UVM, we get to see lots of problems, and we get patients from all different hospitals that they cannot deal with the patient problem, and they send it to UVM. And sometimes, or most of the times, UVM is the last stop for that patient to be treated or to recover or to heal. And some patients are really, really desperate and feel down, because if UVM cannot help them out, who else? Nobody else can. So it really helps talking to the patient and tell them, I feel your pain, but you'll be fine. You're in the right place. We help us. So that is the moment, the favorite moment for me, kind of melt my heart. I'm kind of get emotional now, but I really, because I have to deal with it for so many times, for so many years, and I really feel I really hope that I help somebody in a difficult moment. And next time when I go, they have a smile on their face. Maybe because they happy to see me. Maybe they remember the pep talk I had with them, but they happy to see me, and it makes me happy that they remember me. So back to you, Lisa. What about you?
A wonderful point that you bring up. I feel the exact same way. If we can show that we are compassionate, I mean, the patients, no one wants to be stuck with a needle. And when they come in our chair, our draw chair, they are very anxious. A lot of them are anxious. They tell us up front before they even sit down that I'm afraid of needles. I've had a bad experience in the past. And they're terrified. So I try my best, as well as my coworkers here. We try our very best to be compassionate, to make the patient feel as if they're the only one, and they are. Each patient is treated as an individual. They're not just another patient. We try to remember things about our patients if they're frequent patients. My gosh. And you try to provide the most pain-free experience possible whenever possible. Sure, some patients, they have very difficult veins, but you try to make them comfortable. Sometimes I even go, I don't want to have patient's arm hair pulled, just an example for men. So I will tie the tourniquet on top of the sleeve, and just small things like that. They appreciate that, and they will tell you. Yeah, they say, gosh, I've never had anyone do that before. But that's what we do. And bottom line, I mean, as long as we have the patients and they tell us when they leave, when a patient tells me, gosh, you really made me forget all about that for one moment, you made me feel comfortable. That's in my heart. That's the best that I can ever hear from a patient.
Yes. Yeah, makes you feel good about yourself. The little thing that we do, like you say, when you put the tourniquet above the sleeve. Oh my gosh, you're not going to pinch my skin. Oh my gosh. Oh, my hair gets pulled. Oh my gosh, thank you very much. How come nobody else does it? And I don't know if somebody, and it makes me feel okay. I'm a special one. I guess I have the special touch. I know how to get the blood from that patient, not to pull the hair. Just a simple put the tourniquet over the fabric, and it's yeah, it makes me
It's
feel
a
good.
simple
Simple step.
gesture to do that, a simple step, but it does work.
The list is because some patients can be so rude and mean for no reason. The patients don't like to be poked. And when they see somebody going with the needle, oh my gosh, it can get very, very rude on the patient part. And oh, it makes you feel like I decided to go and poke the patient today. That's because they just want to poke the patient. And they so get verbally abusive with us, with me sometimes. Oh, you here again. I got poked. How many times you guys are going to poke me? See how many bruises I have. You guys messing up with my veins like it's my fault. And they don't get it that I am sent to them by the MD. And this is the thing that used to get me as a new phlebotomist. I used to take it personally. My feelings were hurt. I'm not going to say used to cry, but used to get me a lot. And then with the experience, I realized that that patient is just, again, dealing with something, or they just plain rude. So I learned not to take it personally, explain to the patient, give them an option. Would you like to be would you like me to come back when you feel a little bit better, or you can refuse? You're the boss at the end. The patient is the boss. So I give them the option. What would you like me to do? Do you want me to come back, or you want to refuse the poke? And whatever they decide, sometimes they say, I don't want to get poked, and they pretty much kick us out of the room. Sometimes they say, well, you come back, or you already here, get the blood. But again, the rudeness in the patient gets me, because I'm doing my job and you make me feel bad about doing my job when I come and try to get blood from you. And especially if the patient is difficult and they already mean to us and he has no veins, and you have to make sure you get the blood from with the first poke, not to get the patient upset. And it kind of put a little bit more stress on me, because I'm already frustrated dealing with the rudeness. And then if I miss the patient, oh my goodness, I don't want to miss the vein. I want to get the blood, proof that I can do my job and leave. And it puts additional stress on a phlebotomist. So not only mentally, but physically, now I have to make sure that my hand is steady. I see a vein. I did everything I could to find a vein. And if I miss, I make an apology and send somebody else from the team, see if they can get the blood from the patient. But yeah, it can get very negative and very mean on a part of the patient sometimes. Try to understand it, and I do, and I don't take it personally anymore. I'll move on. What about you, Miss Lisa?
With me personally, I feel that the most difficulty comes when you're drawing a toddler.
Oh, we don't do this in inpatient phlebotomy. I never done it. I've never done it. Wow, look at you, toddler. Wow.
Yeah, when you're drawing a 2-year-old, a 3-year-old, and the children are upset as it is to be there, and to have the kind of pressure where you're trying to locate a vein on this child who doesn't want to hold still. Some of the parents are better at holding their children while we're attempting to draw in the first place than the other parents. But the parents just they put pressure on you because that's their child. I mean, understandably, you don't want to see your child going through this. So but for us, when the parent is just giving us that look, that, and they don't verbalize it. They don't say to us, oh, well, you better get this on the first try.
But you know it. You can feel it.
that,
Yeah.
you do not, and I do not want to poke a child twice. I mean,
Mm-hmm.
best case scenario, you find that vein, you go in there once. I never fish for a vein because I just feel that that's going to cause more injury to said patient.
Yeah.
And on a child, that just you want to do your best and perform your best as a phlebotomist, and you take all your skills and apply those skills to draw those toddlers. I mean, we do that for every age patient, but difficulty, I'd say bar none, drawing a toddler with the patient holding them in the chair. And sometimes, another parent is in the room with you, and lots of pressure,
Yeah.
lots of
Lots
pressure
of pressure.
to, perform. So that would be my most difficult part of my job.
And try to remain cool under the pressure. You don't want to show to the patient or to the family or to the toddler that you feeling the pressure. You still have to be cool, professional. Oh, I got this. I know what I'm doing. I'm going to get it. And yeah, you gotta remain cool under the pressure.
Exactly. Oh, yes.
Well, I would like for them to know that even this job looks simple. Oh, you go get the blood and you leave. And some young people think, oh, this job won't help me grow, or I'm looking for a more prestige, or that job is not prestige. Now, I think it's just that job is, even though it looks so easy, actually has the prestige and can help you grow up because, oh, you know how to you've seen the patients in their worst state, or the sickness that they have, and it's you know how to get blood from a patient that doesn't have a vein, or if you move to be a nurse, oh, you have no problem asking IV or getting blood from the patient because you already done it as a phlebotomist. So that job can teach you a lot. You get to learn how to deal with the patients when they're low. You get to learn how to deal with the nurses when the nurses are trying to help you and the patient, and you need to speak with the nurse regarding the patient labs. Also, how you get to learn how to deal with the MDs because they're so happy to see us, those MDs. Oh my gosh, you guys here, and you get the blood. So we have respect from the nurses, from the MDs, even though some might think, oh, it's a phlebotomy, it's just a phlebotomy, it's nothing big, And then from experience, it happened a couple years ago when I was going to get blood. I was getting blood from a patient, and a doctor came. He was a middle-aged doctor, and he said, "Oh, are you the nurse?" I said, "No, I'm only the phlebotomist." He said, "Don't say that. Don't say I'm only the phlebotomist because you guys are important for us." So that made me feel good because somebody appreciate us. So young people, I really hope that they don't think that job is just a regular job that they need to get on their way to the medical school. That job they can learn a lot, deal with the patient and nurses and MDs, their future colleagues. Back to you, Miss Lisa.
All right. To expound on that a little bit more, Galina, with us being in the outpatient facility, I really believe that it's a good stepping stone. In addition to being a career choice, I'm making this a career. I don't plan on going anywhere past phlebotomy. But for anyone who's going into the medical profession, new students, my gosh, it really makes you appreciate how important our job is, because if you make a mistake, if you draw out of order, if you don't process your labs properly or use the correct tube, that could make a difference in how a doctor prescribes medications.
Yes. Yes.
Oh my
Yes.
gosh. I mean, it's so very important. And I think a lot of the medical professionals, the doctors and the nurses, if they if this was a requirement, a required course, learn phlebotomy, I think they would have a better appreciation of
Yeah.
how very important it is.
Yeah.
And the fact that if doctors, if there's something that's ordered or missed by us, again, that's something that is extremely important. Phlebotomy is, it's an incredible job. I love it. I love the fact that, you have to pay attention to detail. It's not just drawing a patient and moving on. It's drawing that patient and, whatever that outcome is, however you processed that specimen, it could change a patient's life.
Yeah.
It really can. It makes or breaks an outcome in what
the patient treatment
is. Yes.
Yeah.
And I really think that the medical professions as a whole, they don't really understand that. There are some doctors, there are some nurses who, they say yes, pathology, I'm sorry, phlebotomy is very important. It's a great job. But there are others in the medical profession think, oh no, you're just a phlebotomist.
Yeah.
And there's sometimes a little disconcerting, to hear that.
To the profession.
Yes. So, when we do get the respect, which I feel we deserve, and, and I would like to see more up and coming medical students to go through phlebotomy, to see exactly what it is that we do, that it's not just drawing blood. It's a whole lot more than that. And for people wanting to go into the profession, by all means, consider a career in phlebotomy at Michigan Medicine. They train you, they provide you with all the resources, all the support. It's a phenomenal place to get in.